HIVES. Urticaria is an dermatological disease. Look at this picture, shows that skin erosions and disease mechanism. Detail going on. Introduction. HIVES, medically known as urticaria, is a common skin condition characterized by itchy, raised red or skin colored welts that appear suddenly. It can be triggered by an allergic reaction, infections, stress, or underlying medical conditions. Hives can be acute or chronic and may occur anywhere on the body. The severity of symptoms varies, and in some cases, they can be life threatening, especially if associated with angioedema. Definition. Urticaria is defined as skin reaction that causes red or skin colored welts, often with itching, swelling, and sometimes pain. The welt may vary in size and shape and can merge to form larger areas of swelling. Etymology. The term urticaria comes from the Latin word urtica, meaning nettle, as the rash resembles the sting of a nettle plant. The common name hives originates from Middle English hive, meaning a swelling or lump, referring to the rice itchy welts characteristic of the condition. 1. Acute urticaria lasts less than 6 weeks, often due to allergies, infections, or medications. 2. Chronic urticaria persists for more than 6 weeks, often idiopathic, unknown cause, or associated with autoimmune disorders. 3. Physical urticaria triggered by physical stimuli such as cold, heat, pressure, vibration, or sunlight. 4. Dermatographic urticaria, raised welts appear due to scratching or firm pressure on the skin. 5. Cholinergic urticaria triggered by sweating, exercise, or emotional stress. 6. Angioedema associated urticaria involves deep swelling in areas like the limbs, eyelids, and throat, which may be life threatening. Causes: 1. Allergic reactions, food, medications, insect bites, pollen. 2. Infections, bacterial, viral, or fungal. 3. Autoimmune disorders, thyroid disease, lupus. 4. Stress and emotional factors. 5. Physical stimuli, heat, cold, pressure, exercise. 6. Certain medical conditions, leukemia, vasculitis. 7. Idiopathic, unknown causes. Risk factors: 1. Personal or family history of allergies. 2. Frequent exposure to allergens. 3. Chronic infections. 4. Stress and anxiety. 5. Autoimmune diseases. 6. Certain medications, antibiotics, NSAIDs, aspirin. Complications: 1. Angioedema, severe swelling in deeper layers of skin, potentially obstructing airways. 2. Anaphylaxis, life-threatening allergic reaction requiring immediate medical intervention. 3. Chronic itching leading to sleep disturbances and decreased quality of life. 4. Secondary skin infections due to excessive scratching. 5. Emotional distress, anxiety and depression due to persistent symptoms. Pathophysiology: Urticaria results from the activation of mast cells and basophils, which release histamine and other inflammatory mediators. This causes increased vascular permeability, leading to plasma leakage into the skin, resulting in wheals, itching, and swelling. Pathophysiology of hives, urticaria, step by step process. 1. Trigger exposure. Various stimuli, allergens, infections, medications, stress, physical factors activate the immune response. 2. Mast cell activation. Allergens or stimuli cause degranulation of mast cells in the skin by binding to IgE receptors or through non IgE mediated pathways. Example, direct mast cell activation by drug like opioids. 3. Histamine and mediated release. Mast cells release histamine, leukotrienes, prostaglandins, and cytokines, leading to an inflammatory response. 4. Increased vascular permeability. Histamine binds to H1 and H2 receptors on endothelial cells, causing dilatation of blood vessels and increased permeability, leading to plasma leakage into the dermis. 5. Formation of wheals, erythema, fluid accumulation in the dermis results in raised red itchy welts and vasodilatation contributes to redness. 6. Sensory nerve activation, itch and swelling. Histamine stimulates sensory nerve endings causing itching and sometimes a burning sensation. 7. Resolution or chronicity. In acute urticaria, mast cells activity subsidized within hours to day. In chronic urticaria, persistent immune dysregulation or auto antibodies against IgE receptors prolongs symptoms beyond 6 weeks. Signs and symptoms. 1. Raised red or skin colored welts or wheals. 2. Intense itching. 3. Swelling. 4. Burning or stinging sensation. 5. Symptoms that appear suddenly and resolve within 24 hours but may reoccur. 6. Possible respiratory symptoms, difficulty breathing, wheezing in severe cases. Diagnosis. 1. Clinical examination, based on physical appearance and patient history. 2. Allergy testing, skin, prick, or blood test to identify allergens. 3. Complete blood count to check for infections or underlying diseases. 4. Erythrocyte sedimentation rate ESR to rule out autoimmune conditions. 5. Thyroid function test to identify autoimmune thyroid disorders. 6. Skin biopsy in for rare cases if vasculitis is suspected. Nursing diagnosis. 1. Impaired skin integrity related to persistent itchy and scratching. 2. Risk for infection due to broken skin from excessive scratching. 3. Ineffective coping related to chronic itching and discomfort. 4. Risk for impaired gas exchange in severe cases of angioedema. 5. Disturbed sleep pattern related to noocturnal itching. Disease management. First, medical management. 1. Antihistamines, example cetirizine, to reduce itching and swelling. 2. Corticosteroids, example prednisone, for severe cases. 3. Epinephrine, for anaphylaxis. 4. Immunosuppressants for chronic urticaria. 5. Biological therapy for refractory chronic urticaria. Nursing management. 1. Monitor skin condition and assess for worsening symptoms. 2. Educate patient about triggers and avoidance strategies. 3. Administer prescribed medications and monitor for side effects. 4. Provide cool compression to reduce itching and inflammation. 5. Encourage proper hygiene and avoid irritants such as harsh soaps. 6. Ensure a safe environment for patients with risk of anaphylaxis. Treatment options. 1. Lifestyle modifications, avoiding triggers and wearing loose clothing. 2. Pharmacological therapy, antihistamines, corticosteroids, and biologics. 3 alternative therapies: acupuncture, herbal remedies, and relaxation techniques. 4 dietary changes, eliminating potential allergens. 5 emergency treatment, epinephrine for anaphylaxis. Psychosocial medicine. 1 cognitive behavioral therapy CBT helps manage stress related urticaria. 2 support groups encourages sharing experiences and coping strategies. 3 relaxation techniques, meditation, yoga, and breathing exercises. 3 patient education helps improve self care and trigger avoidance. 4 family counseling supports emotional well being and social relationship. Prevention. 1 avoid known allergens, foods, medications, environmental triggers. 2 manage stress effectively. 3 maintain good hygiene. 4 use hypoallergic skincare products. 5 stay hydrated and eat a balanced diet. 6 regularly follow up with a healthcare provider for chronic cases. In conclusion, hives or urticaria is a common skin disorder with various causes ranging from allergic reactions to autoimmune diseases. Proper diagnosis, effective treatment, and preventive measures helps manage symptoms and improve the patient's quality of life. Nurses play a critical role in patient education, medication management, and emotional support to ensure optimal care and prevent complications. Thank you. Have a nice day.